My name is, how you doing, man? My name is Philip White. I'm gonna be doing your discharge teaching today. So you're aware that you have hypothyroidism.
I do.
So your disease process, or your condition rather, it results from suboptimal levels of thyroid hormone, which all that means is that your body does not make enough thyroid hormone.
And what is that?
Thyroid hormone is produced in the endocrine system throughout your body. It helps regulate a lot of your body's functions. The most common cause of this problem is Hashimoto's disease, which involves the immune system attacking the thyroid gland.
Now you know what? I just got diagnosed with lupus.
Lupus? When was that?
3 weeks ago.
Okay. So lupus is an autoimmune disorder, and so with your hypothyroidism, the whole thing it involves problems with your immune system that can, I guess, accentuate or make your symptoms worse, because they're essentially doing the same thing. So I'm not saying that you have Hashimoto's disease, but that's why you could. That's why it's important for you to make sure you come back here with your follow-up visits, so that we could just prevent you from developing all of that. Okay, so the biggest thing with hypothyroidism is that you're gonna be very tired. I'm sure you've experienced a lot of fatigue. And so you wanna make sure that you report any fatigue, lethargy, any unexplained weight gain, cold intolerance, dry skin, or deepening of the voice.
So wait, Paul. So if I'm lethargic, what is this gonna look like?
If you're lethargic, you're gonna be very tired. You're gonna be kind of drowsy.
Don't even be driving.
You shouldn't be driving. If you're feeling like that, you should probably get, if you have a friend or anything, you probably need to get a ride. You definitely shouldn't be driving if you're feeling lethargic. You should also expect abnormal body temperatures and pulse rates and thickening of the skin. So you're gonna need to expect your body temperature to fluctuate, okay?
Like what?
So you wanna stay away from, you probably tend to be cold a lot of times. If you're feeling cold, you don't want to use any warmer blankets.
Why?
You should
I
stay
got one
away.
at the house right now.
You said what?
I got one at the house right now.
Well, you should stay away from that.
Why?
Instead of that, you should use extra clothing instead.
I don't want to do that. I like my woman one. It's just easy for me to do that. Just plug it in and go.
With the warmer blanket, if you don't mind, after I finish all this other instruction, I will go check something at the nurse's desk real quick, and I'll get back to you on that. Do you mind if I do that?
Oh,
All right. Also, you want to make sure that you monitor your cholesterol and foods that you eat. And so we're gonna talk about your diet and stuff in a minute. But I just want to make sure that you also understand that you're gonna, as I was talking about your body temperature, you're gonna express, or you may feel cold all the time, and you may experience a lot of constipation. And so to help with constipation, we're going to want to increase that fiber intake, and we're gonna make sure that we just drink plenty of water, all right?
now, does Kool-Aid consider water?
You said what?
Kool-Aid.
You can, it's not necessarily water, but you need to drink fluids. You just need to
Can't drink Mountain Dew.
I would not drink that.
So how much water do I need?
You need to drink around like 8 glasses of water. But the most
Can I put Crystal Light in it?
Just drink fluids. Just drink fluids.
That's not what I asked you. I asked you, can I put some Crystal Light in it? I need some flavor. I just can't drink no plain water.
You can flavor your water if you would like. Just make sure you drink fluids, okay? That's all. Just fluids. Make sure you're drinking a lot of it. And I also want to make sure that you understand that you're going to be on lifelong medications and therapy. So everything that I'm talking about, you're going to have to be dealing with this for the rest of your life. I just want to make sure that you understand that you can live a good life. You're going to have to manage it so we don't prevent it from becoming Hashimoto's disease.
Okay, so wait, pause, pump brakes. So you telling me that I'm gonna have to change my lifestyle?
You are.
So what is that gonna consist of? I'm gonna have to change jobs or something?
you don't have to change jobs. With with hypothyroidism, it's more so just, not necessarily jobs, just your diet and stuff. How you deal with it.
Have you tried the new Krabby Patty baguette wings? Can I have that?
It's not, you can have anything in moderation, but you specifically want to make sure that you're avoiding foods with high cholesterol. So
But I like that burger though.
You like it, but you can, it's
Is it high cholesterol though?
It is.
How much?
It's a lot.
So you tell me I can't have it?
You should not eat that on a regular basis, no. But anything is good. Anything can be good in moderation.
What else can I have?
You want to have a diet that's low in calories, low in cholesterol, low saturated fats, and foods that are high in fiber. So these are whole grains like oats, oatmeal.
I don't know.
You say you don't eat oatmeal?
Mm-hmm.
You got whole grain bread.
I ain't that either.
Okay, well, any concerns about your diet, any specific taste that you have, we can get the dietitian to come back here and talk with you. But it's just
me and her have already had a discussion. That's what you see her in it.
You right, for sure. My apologies for overstepping. So, any whole grain food that you can find that matches your taste buds.
Didn't I just say I didn't know?
You said.
What's wrong with it?
You can eat cereal.
So I don't eat cereal. I'm lactose intolerant.
Okay. Well, did you hear me say fruits, vegetables?
I like fruits. What kind of fruits can I have?
You can have apples. Apples are good in fiber. Grapes, blueberries, strawberries, bananas.
You ain't talking. All right, keep going.
You got lean protein, like meat.
I just said I like crab fat.
Okay, well, with meat, you want to make sure it's kind of like chicken breast, chicken thighs. Maybe stay away from that red meat though. And you want to decrease fats and sugars. So you was asking me about the milk. I cannot recommend that because sodas, as you know, has a lot of sugar. So even though that's a fluid, it's a lot of sugar in that fluid.
What about diet?
No, it's a soda.
But it's zero sugar. You just have to stay away from sugar. Ain't no sugar in it.
Okay, you can do that. Just make sure you're staying away from excess sugar. That's all.
Okay, what else considered excess sugar?
Like candy.
I don't do candy, so we're good on that.
Okay, well, anything, that's not super healthy. A lot of cakes and all of that.
I don't do cakes, we're good.
Okay, well, let's talk about food that you really need to make sure that you eat.
Right.
So with iodine, with hypothyroidism, we're trying to increase your iodine. We want to increase your thyroid hormone level. So you can eat seafood, dairy, seaweed. You can try egg yolks or table salt.
Jesus.
Now that's pretty much it on your diet. Do you have any questions about that?
Yeah.
Okay.
So, what kind of vegetables can I have?
Broccoli, greens.
Can I have rice?
Yeah, you can have rice. You can.
Brown and white.
Brown.
Brown and white.
All right, so
Can I have the rice wrong again?
you said what?
The rice wrong.
Uh,
It's in a box.
no, you cannot.
Why? If I'm on the go, and I gotta hurry up and fix it, I don't have time to be watching the rice boiling. I need it, like right now.
As long as it's brown rice,
In a box.
yes.
Are you sure? So I don't wanna be back here in the hospital and I'm gonna say, this dude named PJ, that's my nurse, that I can have this. That's the first thing I'm gonna say.
I cannot personally recommend that. No, just make sure for all intents and purposes, as much as you can, just try to avoid like packaged foods and stuff. Make sure that all your food is cooked by hand. You need to stay away from all the store-bought fast food type stuff.
So you telling me I can't go out to eat? That's what you're saying. So you telling me I gotta stay home and cook? Is that what you're saying?
I'm saying that.
That's
So
what it sound like to me.
you remember when I said
Sound like me.
all right, you're right. So you remember when I said that your condition is a lifelong thing. You're gonna have to make lifestyle changes. This is just part of those lifestyle changes you have to make. You can live a good, happy, normal life. You can go out to eat maybe
It
once
don't
a
sound
week.
happy to me.
It doesn't sound like that right now. Nothing sounds happy when you're trying to start it out. But as you continue to keep going, it's gonna get better.
No, that's right.
So this is the thing. I'm 25. Me and my fiance is thinking about having kids. Is this gonna be a problem with me having kids?
So let's talk about your medication.
Yes, let's do that.
So your doctor has prescribed you on Synthroid. And so you want to make sure that when you're taking your medication, you need to take it at least 30 minutes to 1 hour before meals in the morning. So what that means, you take your meds, you wake up, you take your meds, and then you eat. And you want to make sure
Can I brush my teeth first?
you can brush your teeth,
Okay.
but take them at the same time each day. You should also be aware that the medication is going to take around 4 to 6 weeks to take effect. So don't be alarmed if you're not noticing immediate changes right away, okay?
Gotcha.
You also want to be aware that your propanol for your anxiety medication, it can increase the effectiveness of your Synthroid medication for your thyroid. And so you talked about your fiance, so your oral contraceptives that you're taking, your birth control, that can increase your thyroid hormone by itself. So you want to be careful with taking that alongside with your Synthroid, because those birth control pills and your thyroid medication, which is already trying to increase your thyroid level, we don't want to increase your thyroid hormones too rapidly, and that can cause a problem in itself.
What's gonna happen? I'm gonna die.
Death is strong to say, but it can cause you to develop another condition
Like what?
like hyperthyroidism. You have low thyroid hormone right now. So if you increase it too much, you can go into hyperthyroidism. And a complication of hypothyroidism is something that we call thyroid storm. So we can avoid all of that if you just be cautious when taking your birth control pills. Just don't mix them together. That's it.
Mix them together. Got it. Can I take my medicine with anything? So I can drink with anything?
No. Avoid like grapefruit or citrus drinks, because that can disrupt the absorption of the medication. So you'll be taking it for nothing. So don't do that. That's all the information I have for you, ma'am. If you have any other questions, we can get the doctor to come down here and talk to you. But you have a very nice day, okay?